just like that. Okay. So what we're doing there is we're opening the mouth, but only doing the rotational component, which is the piece that typically is pain-free and not tugging on those irritated areas.
Okay.
And so by just rotating in the joint like this, what you can do is you can pump fluid in and out of the joint. You can slightly mobilize it and stretch it. And it's usually a great starting point to get relief.
From CareCredit, it's Care Experts, a podcast where we dive into the health and wellness industry with the professionals that make it happen. I'm Erin Treloar. Today, we're joined by Dr. Joe Damiani, a specialist who focuses on TMJ, neck, and head pain. He's here to help us break it all down and give us the tools we need to understand and treat jaw pain more effectively. Dr. Damiani has developed a framework he calls the 3 buckets of jaw pain, which helps pinpoint whether your discomfort is coming from neck issues, TMJ dysfunction, or stress and tension. He's here to explain how each of these factors plays a role, how to tell which one is affecting you, and what you can do to finally find relief. Hello, everyone, and welcome to the Care Experts podcast. I'm so thrilled to be sitting down with Dr. Joe Damiani to talk all about jaw pain today.
Thank you so much for having me, Erin.
So you're clearly an expert in this area. How did you end up becoming an expert in jaw pain and TMJ?
Well, it all started with my own personal experience of headaches, neck pain. I was getting motion sickness in the car, and I felt like I was kind of stuck in this loop of pain. And after a week, after a month, I figured this has to go away soon. But it lingered and lingered and lingered. And coincidentally, at the same time, at the clinic I was working out, the person from the front desk came back and said, "Does anyone want to treat TMJ?" And the other therapist said, "I'm not sticking my hands in anyone's mouth." And I was like, I don't see a big deal. I'll do that. And when you start treating jaw pain and TMJ disorder, you start to realize it's not isolated. So then I started getting headache patients and neck patients and dizziness patients. And they were telling me the same things that I was experiencing. And when this all started to come together, that's when I decided to take a deep dive into it. And then fast forward till now, and here we are.
Somewhere along the way in that journey, you started sharing what you were learning with individuals on social media, and you have since grown your audience to over 2 million followers across your different channels. So you truly are an expert in this area, and you train individuals in this work?
Yes. So I have a clinic in New Jersey, in Wyckoff, New Jersey, and I also have online services for people who can't come to me to treat these same things.
Amazing. Now we're going to talk about the 3 buckets of jaw pain today. And I thought we could start the episode off by just talking about some common symptoms that arise that could be potentially linked to these 3 buckets. Do you want to start off by just explaining what the 3 buckets are?
Sure. If you're having pain on your face in the region of the jaw, we can't just blindly give you exercise. We need to know what could the cause be, and some of them might surprise you. So the first bucket is true TMJ disorder. So there's an issue with the joint of the temporomandibular joint. That's bucket number 1. Bucket number 2 is that the pain could actually be referred from the neck. So all the pain that you're feeling on the jaw is simply referred by the neck, and there's nothing wrong with your jaw at all.
Okay.
And the third bucket is stress and clenching. Or stress and tension, I should say. And clenching comes part of that. So being stressed, being worried, clenching your teeth, it produces jaw pain. But there's not necessarily something wrong with the TMJ joint as in the first bucket. So that would be the 3 buckets.
You just pointed to your face. Can you describe where the TMJ is for anybody who's not familiar with that?
Yeah, great question. So it would go from basically right in front of the ear. It would be stay underneath your cheekbone, and then it would drop down to the bottom of the jawline.
Okay.
So that would be the area.
Amazing. And you mentioned in your own story that you were experiencing not only jaw pain, but dizziness, headaches. How often are these things interconnected?
They are interconnected very, very commonly. So there's a couple different things with this. First of all, when the muscles of the jaw are actually really tight and restricted, they can produce the feeling of dizziness. That's number 1.
Interesting.
Yes.
How does that happen?
So because of the way that they compress not only the TMJ joint, but also the muscles in the area, like I was saying, it's right up against the ear.
Yes.
And there's just interconnections of the nerves in that region. And the inner ear is connected to dizziness.
I know that there are also a number of people who struggle with vestibular issues,
Yes.
but this is separate.
Yeah.
So a TMJ issue is a separate issue from a vestibular
Yes.
issue.
So the other thing with dizziness is this. So your balance centers and dizziness, you gain your balance from vision, from the inner ear itself, and from proprioception. Proprioception is your body's positioning in space. So if my head is tilted to the side, my muscles and joints give information to that vestibular center that says, hey, he's tilted to the side.
Right.
And if that information is confusing, if for some reason I think my head's tilted to the side, but it's not, it produces dizziness. So the upper 3 cervical vertebrae are very, very rich in these proprioceptors. And if you have a restriction in one area, you're getting misinformation to the vestibular system and you experience dizziness. So that's why people who have neck pain can experience dizziness. Also, because of the arteries, nerves, and the muscles in that area of the upper neck, when they're compressed or shortened, they can also produce headaches. And that's why people have headaches. And on top of it, the nerves of the neck connect to the nerves of the jaw at this thing called the trigeminal cervical nucleus. And sometimes you could have neck pain and it's almost like a mistake in the body. It gets caught in this loop of nerves and it projects it on the jaw. So the neck can cause dizziness, headaches, and jaw pain as well. So it's a very complicated region.
Wow. Okay. And if somebody's experiencing pain, dizziness, headaches, how long would you suggest that they wait before asking a professional? Because as I'm hearing you talk about this, it's complicated. We can't just stick some ice on it or take some Tylenol.
Right.
What is a normal amount of time for the body to heal?
So we've all had injuries that happen or pains and they go away in a couple days, right? And so I think it's very fair to just start experiencing this and just give it a time, give it a week, couple weeks, see what happens. There's no harm in ever starting too early. But if it's lingering on and it's been a month now, I would absolutely go seek professional help, because you don't know if it's going to be one of those cases that is going to pan out for a longer period of time, and you don't want to let it start catching momentum. Things get tighter, your nervous system gets more irritated, and it can just get worse and worse over time.
Okay, amazing. So somebody's listening right now and they're like, I have clicking when I'm eating, or I've got tension, stress pain in my TMJ that I'm noticing. Can you go through the 3 buckets with us again and tell me a little bit more about how somebody would know which bucket their pain falls under?
Absolutely. So let's start with the neck, okay? Because we've been talking about that. So if you're having jaw pain and you're wondering if it's coming from the neck, there's a couple things you could do. Something I have people do is do a slump test. So they sit in really, really terrible posture. Like you slump all the way down.
Can you show me? Show me some terrible posture.
So you would be hunched this way with your head here, and I might have you stay there for 30 to 60 seconds.
This is tech neck, right?
This is
what we're starting to see more from everyone hunched over their technology.
Right. Yes, it's very common now. So you're slumped down like this.
Yes.
That compression there, if you stay with there for a while, if that is what's causing the referred pain, it may show up.
Okay. So we're actually trying to aggravate and provoke that area to determine whether or not this is causing it.
Yep.
And then if you straighten your posture, sit up, shoulders back a little bit, chest open.
Yep. And
now I'm just making things up,
no,
Dr. Joe.
You're
so you tell me.
Yeah. So
and so if our posture's improving and the pain improves, then we know.
Then we know it has to do with the neck.
Okay.
Great. And then there's other simple things you can do, like go through full neck range of motion. So you would rotate side to side, you would tilt, you would look all the way up and down, and you would see if it starts eliciting symptoms on your neck.
Okay.
And then if it does, elicit symptoms on your jaw. And if it does, now again, it's hinting to the fact that this could be coming from the neck.
So the second bucket.
So that would be the TMJ disorder itself in the joint. So with that, something you could do is you could open your mouth all the way.
Okay.
You could close your mouth all the way. Is there any type of clicking or popping or discomfort that resembles what you experienced during the day?
Right.
If that doesn't do it, what you can do is you can, sitting there, shift your jaw to the left, shift it to the right, and you can push it forward. Like shift your jaw all the way forward. Does that create the symptoms that you're complaining of? That would be something else that tunes you into the fact that it could be a TMJ joint issue. And if things like talking, eating, kissing are producing your pain, that's also tuning us into the fact that it's probably a TMJ issue. So that's a simple way to assess it at home.
Okay. Let's talk about bucket number 3.
So if you did the test for the neck and nothing showed up, and now you did the test for the TMJ and nothing showed up, next we're going to bucket 3. If you wake up in the morning with a sore jaw, if you get headaches above the ear, and if you clench and grind your teeth, that will be signs you're in that stress and tension bucket. And the other thing is, if you actually poke on the muscles below your cheekbone, they're called the masseter muscles, and you massage them and poke on them.
Yeah.
And then you also go to the muscles on the side of the head, which are above the cheekbone, and those are painful. If either of those are painful, that's a increased likelihood that it's coming from that stress and tension bucket.
Gotcha.
Yeah.
Stress and tension is coming up quite frequently, and I feel like a lot of people these days are stressed and they're holding tension. I would love to talk about whether or not there's any home exercises or remedies that people can do for stress and tension, but the other buckets as well.
Yep. So for stress and tension, the first thing that you could do is start actually massaging the muscles.
Oh, I love this.
Yeah. And I like to call it muscle priming, because something you have to understand about this is if you just massage painful muscles, typically eventually will come back again, because something causes the muscles to ache and hurt. Muscles don't do this on their own unless someone, punches you in a muscle or pinches the muscle. They tighten up because they're being used the wrong way. They're being over shortened, over lengthened. So I like to call some of these strategies muscle primers, because you're priming them for success. But then what do you have to do to stop them from going into that same loop again? And a couple things you could do is, number one, work on posture.
Yes.
Because I have a simple test that you could do right now, actually.
Okay, let's do it.
So what you could do is you sit up tall, you chatter your teeth, and then you slowly bring your head forward like this. All the way forward. And what you'll notice is the teeth are contacting back and back more in your jaw. Give that a try again. So you chatter and you move forward. You'll feel your teeth are contacting different areas.
Yeah.
So simply by having your head forward, it's actually changing the position of your jaw. And this can create irritation and cause you to want to clench more.
Okay.
So improving your posture is really important. A night appliance is also good for these people, because eventually, this is the interesting part, someone who's in that stress and tension bucket from clenching all the time, eventually you could cause what's called synovitis, which is inflammation in the TMJ, and that could degrade the joint, and then you could actually be into the TMJ bucket where it's a joint issue.
Now we're jumping buckets.
We're jumping
Not
buckets
ideal.
now.
We want to stay in one bucket.
Yeah, exactly. So if you use an appliance, it can decompress the TMJ, so there's more space in there. It protects your teeth, but it will not guarantee that you don't stop clenching. In fact, some people clench even worse with those devices in, but at least it'll give you some protection in your TMJ.
And also protecting your teeth and your enamel as well.
That's an appliance for clenching and grinding. The only guarantee is that it protects your teeth, and it will decompress your joint. But there's absolutely no guarantee in terms of, is it going to stop you from clenching or not?
Okay.
Yeah, right.
What is an ideal posture to support our jaw?
Yep. So the ideal mouth posture would be to have your tongue up to the roof of your mouth.
Okay.
Your teeth separated slightly and your lips sealed. Okay. You're in that position. Now you've aligned the TMJ a little bit better.
Okay.
You can work on nasal breathing, because when you're doing mouth breathing, that actually, it does a few different things, but by having the mouth open, it shortens certain muscles in there that cause bigger problems. And then the classic chest out, shoulders back, like head upright.
And this is optimal positioning for ideal jaw health.
It's jaw posture, yeah.
It's jaw posture.
Yeah, that's the optimal jaw posture.
Okay.
Yeah.
So if somebody has identified that they think they're in the TMJ category of jaw pain, do you have any exercises that you would recommend for them?
Yeah.
Do you want to grab Tony for this one?
Yeah, I got Tony.
Dr. Joe has a skull here.
Yeah, so this is a great starter exercise, and I just want to explain the reasoning as to why.
Okay.
When we open our jaw, it rotates like this, but then it actually does translate, which means shift forward. That's the normal mechanics of the jaw.
Okay.
So you rotate, and then it just shifts forward in the joint a little bit.
Okay.
Okay. That shifting is usually where discomfort occurs, because the disc in there usually gets compressed or pulled on. Some of the retrodiscal tissue gets elongated. It produces discomfort. So if we bring our tongue up to the roof of our mouth, so do this with me. Say,
I'm doing
yeah, say no, now, never.
No, now, never.
Okay, think about where on the roof of your mouth your tongue hit, right?
Yes.
Place it there.
Yeah.
And then open your mouth as much as you can before the tongue comes off the roof of the mouth. And close. Just like that. Okay? So what we're doing there is we're opening the mouth, but only doing the rotational component, which is the piece that typically is pain-free and not tugging on those irritated areas.
Okay.
And so by just rotating in the joint like this, what you can do is you can pump fluid in and out of the joint. You can slightly mobilize it and stretch it. And it's usually a great starting point to get relief.
And how many times would somebody do that?
So I like to tell people to do this 10 times,
Okay.
3 times a day.
That's so easy.
Very, very simple.
All right.
So the protocols that I use for this chronic pain population is doing small, very easy to complete efforts multiple times throughout the day.
Right.
Because even if you have the best routine, this is the perfect routine, and you're just going to do 30 minutes every morning. The rest of the day just kind of crushes those efforts because life just does what it wants with you. And so this way you keep interrupting that lifestyle piece, and that's how people really get better.
Okay, so set your alarm on your phone for 3 times a day.
Yeah.
This is the kind of exercise we can all get behind. You can be
exactly.
sitting down, you can be in your car,
Yes.
and just opening that jaw 10 times.
Yep.
And as you said, it will start to remove some of the tension, get fluid pumping in there,
Exactly.
promote healing.
Yeah.
Great.
And I usually recommend to people because you know how we never pay attention to our alarms on our watches and phones anymore? We're like, oh, it's just another thing going on.
Yes.
You buy like a $5 or $10 timer.
Yeah.
You place it on your desk and you set it like that. And that's something people typically will listen to more. And it really helps improve the compliance.
Okay, so the alarm is going on the watch that's separate from your phone, which you've learned to ignore.
Exactly.
Gotcha.
Exactly.
Okay, amazing.
Yeah.
And then let's talk about the final category.
Well, let me just grab Tony's spine here now. I got his spine in his head, and I just want to
Tony's so
show
helpful.
you how this works. So the head sitting on the spine just like this, right?
Okay.
If we have compression, this is only one of the ways it can happen, but if we have compression here where think about the posture we were just putting ourselves
that
in.
forward posture, your shoulders are rolling over, your
Correct.
head's heavy.
If there's any compression here like this,
Yes.
or it's more than just posture, there can be other issues going on inside the spine.
Mm-hmm.
So if those issues are occurring in there, the compression, the irritation refers out to the jaw.
Mm-hmm.
Okay. So a great starter exercise, again, would be just to start decompressing this area, just kind of opening it up like this, just getting some of that area compressed. Because again, this is bad back here.
Yeah.
And this feels a lot better. Okay. And so the way that we can do that, I'll show you now on myself. So one thing that you can simply do is I like to tell people, put your hand on your chin and kind of pull it towards your chest, okay? And take your other hand and put it on the base of your skull, like really on the nook of the base of the skull. And while keeping the hand on the front of the chin, pull your head kind of a little bit up and forward with that backhand. And you could feel how it's taking that upper neck area and it's straightening it. It's lifting it up.
It feels so good.
Yeah, everybody could use this one.
Heavenly.
And so that's one great way. And what you could do is you could do a 10, 20, 30-second hold of that.
Okay.
And again, you can sprinkle that in 3 times a day. Maybe you do 2 sets of it, like 10 to 20 seconds, and then you do it 3 times a day. And it's just a starting point. Because remember, when it comes to the neck, there could be all different things going on. You could be tilted a certain way, rotated. It could be one side versus the other. And so we're trying to give the best starter strategy possible. And I find that this is a great one because you're just globally just lifting the whole spine. It's going to get a little of both sides, and it could be a great starting point for relief.
When I just did this, I don't know if this is normal, I almost felt a tiny bit lightheaded.
Yeah.
Like not in a bad way. It wasn't dizzy.
Yeah.
But I guess there's so much going on
There's
in
a
this
lot of-
area
there's
of
blood
neck
flow too.
and tension that's being held. So if you're doing this along with us and you're noticing anything, of course, if it gets extreme, please stop. But otherwise, you just notice what comes up for you in your body when you're moving in different ways.
Absolutely. And there's arteries and blood flow there. And so when we're forward, it's just a little bit of a smaller space for everything. And we're able to open it there. And so that would be something that's pretty common to experience.
I'm learning so much and learning how complicated and intricate this area is. So I would like to flag that if you're experiencing long-term pain, discomfort, clicking noises, dizziness, headaches, that seeing a healthcare provider who's really experienced in this area is an absolute must.
Yes, absolutely.
What should people look for when they're going to find somebody to help them with this?
You do want to find someone who specifically specializes in this area. Yeah. So you could go to a website. There's a lot of websites that will show like we treat everything. You see every single body part on there. Yeah. So that's the tricky part. You may Google like TMJ rehab, something along those lines. Mm-hmm. But if you go to the website and you see that it's also foot rehab, knee rehab, hip rehab, they just have a page for every one. That's probably not the best way to go about it. You want to see on there headaches, dizziness, neck pain, TMJ disorder.
This is something that they are working with all the time and that they specialize in.
Absolutely.
And I imagine some of the more mechanical things that you're working on as a physical therapist, if you are in a very stressful job or in a very stressful season of life and you've got a lot of that tension and things, you may be needing to, alongside the work that you're doing with you, be working on de-stressing and navigating that other stuff.
Yes, absolutely. So stress, the nervous system, like the way that, like how you're sleeping, what you're eating, is your body in an inflammatory state? There's other things that can complement onto this for sure.
I have learned so much in this conversation from you. Thank you so much for joining us today.
You're welcome. Thanks for having me. This was a blast.
Hey there, don't leave yet. Just wanted to say, if you want to hear more about health and wellness, check out these episodes of Care Experts. Also, before you go, make sure you like and subscribe. New episodes drop every Wednesday.